Thank you for joining Essential Therapies podcast. Dr. Cindy here with some more road reflections on my country commute. So we are talking about the calm technique, which I put together, I think it's probably about 6 or 7 years ago now, when I was trying to help my patients get better at their own self-treatment. So I decided to really take apart what is it that I do every day in my thought process to treat myself using myofascial techniques. And I came up with the calm technique: connect, assess, listen, and move. So today we are talking about listening. And if you missed the other ones, I encourage you to go back a few podcasts and catch up, because this is really the heart of learning how to really care for your body. And we have not been taught this anywhere that I have seen, from the day we were sent off to school and even younger, really, where we are encouraged by those around us to not pay attention to our body's signals, because there's other stuff we have to do, So God forbid we listen to our body's needs and listen to them to take care of them, right? So here we are at listening. And after we've connected to our bodies and we have assessed what is going on in a left brain sort of way, and by that I mean in the John Barnes myofascial approach, we talk about channel 3 and channel 5, channel 5 being more left-brained, more of our intellectual side, as opposed to being more centered, and channel 3, or feeling inside of our body and being present, and what I like to think of as connecting to the heart. So the assessment is channel 5, the listening is channel 3, and being connected and feeling inside of our bodies. So what do I really mean by listening? So as we are being aware of our body and our mind connection and feeling in a really just physical way. For example, you might have some hip pain, or you might have some discomfort in another area, or you might have tightness, and you can assess, really take note, maybe how much motion you have available here compared to the other side. I'm thinking of maybe someone who has a hip that's glitching, and they can tell when they're doing different positions that this right side isn't moving the way the left side is. So you're really assessing that movement. When we listen, we're feeling deeper into that sensation that we're having. And it might not even be pain, it might be something else. And you can really begin to feel where these connections go in the body if you start to pay attention. If you really tune out everything else and feel into your body, where is that going? Now, you may want to add to that some lengthening techniques. I've been teaching a lot of lengthening to help people get this understanding of the connective tissue, the fascia, the communication highway really in our body that connects every single cell. As you lengthen through, or maybe you're rotating and lengthening and feeling, where does that go? So for example, oftentimes as I'm doing, say, bilateral leg pulls, I'm connecting into the patient and just feeling throughout their body by doing this simple technique. I can feel all the way up into the body where these restrictions are, and the patient can tell as well. Now, sometimes they're only feeling where my hands are on their ankle or foot, but as they practice this, they begin to sense and feel these connections throughout the body. I can oftentimes have someone say, wow, I feel that in my back, or I feel that in my left hip, or I feel it in my jaw, or I feel it in my neck, so many different places. And so as we quiet down our left brain, as we come out of this whole intellectual, analytical side of trying to figure stuff out, and we just feel what's happening inside the body, almost going into an imagination type of state where we allow ourselves to be open to these connections throughout the body. And it might not just be connecting from one area to the other, it may be bringing up emotion. So I know for many people this may sound foreign, that we hold emotion in the body, but we do. And everything that we experience in life is recorded in our fascia, this liquid crystal flowing system within our bodies. And many, many times, in fact, most times when I'm self-treating, especially when I'm able to really quiet down and not be interrupted in my environment, I will feel the emotion that is connected in this area. Or it could be anything from joy to sadness to just so many different things. And maybe there's not even a label for it. I feel like our language is very limited when it comes to these things. So what you're sensing in your body could be a sensation of tension or tightness, but it could also be a sensation of sadness or joy or grief that needs to surface and arise so that you can release it. I have a saying, and it's an acronym, FEEL, FEEL. Early in my treatment days as a patient myself, I was very left-brained. I was still in graduate school working on my PhD, and I had a harder time back then staying present in my body. So I would say in my head over and over, feel, 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 because my brain would wander off to something, or I might start analyzing and becoming very, critical of what I was feeling. And so instead, I would focus on where the therapist's hand was, and I would say, feel. And that would encourage me to feel deeper in my body and just see what was there. And that really helped me bring up a lot of emotion that was stored in my body. So the acronym FEEL, of course, the F stands for feel. I tell myself to feel. The first E is engage. So I wanted to engage that sensation, whatever it was, so that I'm not necessarily running away from it. Sometimes, we have uncomfortable feelings, emotions, and sensations in our body that we just want to turn off because we don't want to deal with it. Well, instead, this is engaging whatever sensation that is. Then, after engaging it, embracing it. That's the second E, to embrace this discomfort or this sensation. And as we embrace it, it gives it a chance to soften. And I almost think of it as embracing with my arms, embrace this whatever. And as we hold it with acceptance and almost a surrender, that which we are holding can start to soften and maybe even slip through the arms as we L, which is the last letter, let it go. So letting it go is the last item of the FEEL acronym. And I feel like we have to feel things, we have to embrace them, we have to engage them first, and then we embrace them, and then we let them go. And we can't let something go if we don't do those things. So that to me is part of also this listening phase of what all is within the body. What is it telling us? What needs to be addressed or acknowledged so that we can let it go? And as we feel these connections, it brings up many opportunities for self-treatment where we can be guided to treat and release and feel better now without having to kind of push things aside and just keep dealing with it. So that is the listening. Remember, without awareness, we have no choice. So as we continue to listen more with our bodies, to our bodies and the emotions and all of the things that are there, there's so much more ahead of us. So next time we will talk about MOVE. What does M stand for in the calm technique and what that means? And for now, remember, you are creating tomorrow's body today, and building your self-treatment techniques and program are key for a great outcome. Thanks for joining and have a great day. See you next time.